Welcome to the training session on reporting COVID-19 vaccination data on healthcare personnel. This webinar is geared toward facilities submitting data through the COVID-19 vaccination module of the healthcare personnel safety component. My name is Elizabeth Kyle, and I work with the Division of Healthcare Quality Promotion at CDC. As a reminder, facilities can contact CMS with questions about reporting requirements. Please use the email addresses listed on the slide to contact the appropriate program. The main objectives of today's webinar are to review the form changes in the NHSN surveillance definition of being up to date with COVID-19 vaccines. Please note that the form changes are now implemented in the NHSN application, beginning with the week of January 1st, 2024. We'll then review example scenarios of how to report data on healthcare personnel working in facilities. Please note that slides from last week's webinar are already posted to the NHSN webpage. We'll post updated slides from today's presentation in the coming weeks. Let's start with an overview of how the weekly COVID-19 vaccination data collection form has been simplified. I'll now provide some brief background information on the form changes. The COVID-19 vaccination reporting form for healthcare personnel has been simplified by removing the question on complete primary series. This reflects the latest guidance from CDC and the FDA. It also allows us to collect data that are most relevant for public health. In addition, the change enables us to be consistent with CMS quality reporting program measures, since these will now transition to collect data on up-to-date vaccination. Here's a view of the previous weekly COVID-19 vaccination form compared to the updated form that became available in January 2024. Let's review the key points for today's presentation. Beginning January 1st, 2024, up-to-date vaccination is now captured in question 2, which was formerly question 4, and data on primary vaccination series are no longer collected. Healthcare personnel should not be counted as up-to-date with COVID vaccines until they receive the 2023-24 updated vaccine. NHSN is monitoring data and sending data quality outreach to facilities who are now reporting a higher than expected number of healthcare personnel who are up to date. In questions 3.1 to 3.3 will now refer to healthcare personnel who are not up to date in question 2. Now we'll look more closely at the specific form changes. This slide highlights that we are removing the question on the cumulative number of healthcare personnel who received a complete primary series, which is question 2. The question on up-to-date vaccination, which was previously question 4, is now moved to question 2. Please note that question 3, the cumulative number of healthcare personnel in question 1 with other conditions, now relates to healthcare personnel who are not up to date with COVID-19 vaccination. In the next few slides, we'll review how to answer questions 1, 2, and 3 on the form. For question 1, facilities should enter the number of healthcare personnel who were eligible to have worked at the facility for at least 1 day during the week of data collection. Please note that the vaccination status for all healthcare personnel reporting in question 1 must be reported in either up to date with COVID-19 vaccines, which is question 2, or other conditions, which consist of questions 3.1 through 3.3. Also, the sum of the numbers entered for questions 2 and 3.1 to 3.3 on the form must be equal to the number entered for question 1. If the numbers are not equal, the NHSN application will not allow for the data to be saved and will instead generate an error message. Question number 2 asks for facilities to report the cumulative number of healthcare personnel who are up to date with COVID-19 vaccination. And you should only count healthcare personnel who received the 2023-24 updated vaccine. Please note that many healthcare personnel who previously had completed a primary series will not be counted as up to date. Question number 2 does not refer to primary vaccination series anymore, so please note that the data are no longer collected. Facilities are encouraged to use a document titled Understanding Key Terms in Up-to-Date Vaccination to review the definition of up-to-date vaccination by each reporting quarter. Question number 3 pertains to the cumulative number of healthcare personnel in question number 1 with other conditions. In other words, these healthcare personnel are not up to date. Question 3.1 is defined as not up to date due to having a medical contraindication. Question 3.2 is defined as offered but declined the vaccine required to be up to date. Question 3.3 is having an unknown or other vaccination status. So let's discuss data quality outreach. Facilities should only count healthcare personnel who received the 2023-24 updated vaccine. If you don't have any healthcare personnel who received the vaccine, please report 0 for question number 2. Also, we've observed that many facilities are reporting a higher than expected number of healthcare personnel, beginning with the week of January 1st as up to date. If there is over-reporting, the NHSN team will send data quality outreach emails to facilities and request review of the data for quarter 2. Keep in mind that individuals are not up to date with COVID-19 vaccination, and they must be reported in question 3.1, 3.2, or 3.3. Individuals having a medical contraindication that prevents them from receiving the vaccine are reported in question 3.1. Individuals who are offered but declined vaccination that would make them up to date are reported in question 3.2. All other individuals who are not reported in question 2, 3.1, or 3.2 are reported in question 3.3, which is unknown or other COVID-19 vaccination status. We'll now review some instances of individuals who should be included in question 3.1. Individuals are counted in this category if they are medically contraindicated. For example, if they had a severe allergic reaction when receiving a previous COVID-19 vaccine dose, or if they had allergies to any of the ingredients listed in the COVID-19 vaccine. We'll now review some instances of individuals who should be included in question 3.2, which is offered and declined vaccine. In one example, a facility held a vaccination clinic to offer the 2023-24 vaccine. Prior to the clinic, an employee informs the clinic organizer that they do not wish to receive the vaccine. In another example, a newly hired employee was offered the updated COVID-19 vaccine during a new hire employee health review. The employee verbally declined the vaccine. We'll now review some instances of individuals who should be included in question 3.3. Individuals should be counted in the category that the facility could not determine an individual's vaccination status. For example, a facility is not offering the COVID-19 vaccine and does not have information on their up-to-date vaccination status for the healthcare worker. Another example is if an individual received the vaccination outside of the facility but did not provide written documentation of vaccination. As a reminder, please note that individuals can self-report in writing that the vaccination was received elsewhere or provide documentation of receipt of the vaccine. Documentation should include the date and location of where the vaccine was received and vaccine type. Individuals who have not yet declined and stated that they would like to receive the vaccine are also counted in question 3.3. In some cases, individuals are trying to obtain more information about the vaccine. In addition, some individuals may be planning to receive the vaccine, but they may not have had time to receive this or attend vaccination clinics. Now let's look at how to report data on healthcare personnel using the updated form. Here's an example using the employee category. Out of the 100 employees reported for the week, we see that 75 of them are up to date with vaccination. 2 employees reported medical contraindications, 10 declined vaccination, while 13 reported unknown or other vaccination status. When you add the numbers that are reported for questions 2 and 3, you'll see that they add up to the number reported for question 1, which is 100. We'll now review the definition of up-to-date vaccination that is being used for quarter 1 of 2024. The definition of up-to-date vaccination for NHSN surveillance has changed over time. Facilities should use the definitions outlined in the following document that is linked on this slide for each reporting quarter. This slide lists various COVID-19 vaccine types. To be considered up to date, an individual should have received the 2023-24 updated COVID vaccine. On September 12, 2023, the updated Pfizer and Moderna COVID-19 vaccines were recommended by CDC for use in the United States. On October 3, 2023, the updated Novavax vaccine was recommended for use. For the current reporting quarter beginning in January of 2024, individuals are considered up to date with their COVID-19 vaccines for the purpose of NHSN surveillance if they received an updated 2023-24 vaccine. This slide presents the information we have discussed in a flowchart format. Facilities can use this flowchart to decide if a healthcare worker is up to date with COVID-19 vaccination. Now let's review a few examples of how to report COVID-19 vaccination status for healthcare personnel. This example focuses on Chloe, who is a healthcare worker. Chloe received 2 doses of the original Moderna primary series in June of 2021. She received a bivalent Moderna vaccine in December 2022 and received a 2023-24 updated COVID-19 vaccine in September of 2023. Where do we count Chloe? In this example, we would count Chloe in question number 2 as up to date because she received a 2023-24 updated COVID-19 vaccine. For our second example, Mark received a dose of the bivalent Moderna COVID-19 vaccine 5 months ago, but declined all COVID-19 vaccines since then. In this instance, Mark should be counted in question 3.2, declined vaccine, because he declined to receive the 2023-24 updated COVID-19 vaccine. Kit is a healthcare worker. She refused all previous COVID-19 vaccines, but decided to receive the 2023-24 updated vaccine. Where do we count Kit? Kit should be counted in question number 2 as up to date because she received a 2023-24 updated COVID-19 vaccine. In this scenario, Josh received a dose of the bivalent Pfizer vaccine on August 15, 2023. He is unsure if he will receive the 2023-24 updated COVID-19 vaccine, but it hasn't been offered yet. Josh should be counted in question 3.3, unknown and other vaccination status, because he has not yet received the 2023-24 updated COVID-19 vaccine, but he also has not declined this. In our final example, Michael reported a medical contraindication, and this prevents him from receiving the 2023-24 updated COVID-19 vaccine. Michael should be counted in question 3.1 because he has a medical contraindication that prevents him from receiving the 2023-24 updated COVID-19 vaccine. Let's briefly review the key points again. For quarter 2, only count healthcare personnel who received the 2023-24 updated COVID-19 vaccine. Please note that many healthcare personnel who previously completed their primary series are not counted as up to date. And question 2 no longer pertains to primary series. This was removed from the forms and no longer collected. And questions 3.1 to 3.3 will now refer to healthcare personnel who are not up to date for question 2. We'll now review additional updates and reminders about NHSN data reporting. NHSN previously used data quality assurance alerts. However, these have now been retired. CMS tables are now available to review a detailed summary of weekly COVID-19 vaccination rates. The tables can be accessed using the Analysis tab on the left-hand navigation bar of NHSN. Facilities are also encouraged to use the person-level vaccination form. The form will apply the up-to-date definition for you for Q1 of 2024. Now we'll discuss some key resources. The Healthcare Personal Safety Component website contains links to a variety of training materials, including quick reference guides, training slides, and information on CSV file upload. For facilities who use the CSV file upload, please note that the CSV files have been updated and remain an option for submitting data. This slide shows where the person-level vaccination resources are located. You will find several guidance documents along with information about CSV data import. CDC is happy to assist with any questions you may have. Please use the NHSN service now to submit questions. The new portal can be accessed using the link listed on this slide. This concludes the presentation. Thank you so much for your time. We'll now have the opportunity to answer questions.